This episode of the Operatory podcast is brought to you by Opera DDS, the easy solution for communication in your dental practice, between dental practices, and with your specialists. Paperless forms, secure email, full recall, and intra-office communication with chat and teledentistry, all available at operadds.com. Welcome to the Operatory podcast, the podcast about burying dinosaurs in dentistry, moving past outdated procedures and technology to find a better way. Hey, David Pryor, our patient friend who's on our podcast all the time. I would like to welcome you once again.
Why, thank you, Brian. Thanks for having me.
You're absolutely welcome. I'm very jovial today.
Yes, good.
Yes. You know why?
Why?
Because our topic today is near and dear to my heart.
There's so many things near and dear to your heart, I couldn't possibly isolate it down to one. What could it be,
true.
Brian?
Well, this one is about actually attention in healthcare today.
Okay.
It's attention in technology in healthcare.
Okay.
And I can't wait to hear what you think of this as a patient.
Okay.
The tension is between security and interoperability.
Yes.
You know, could you define, because I think I'm not asking you to do something that's not in your wheelhouse.
Okay.
Like interoperability, as a patient, what that means to you.
Define the word.
Okay. So interoperability means basically if I'm a dentist and I see David Pryor,
Yep.
and then David Pryor leaves my office and goes to another office, that you can pull up the chart there.
Oh, okay.
Right.
Yep.
So it's more of a term in medicine. I feel strongly it's going to be coming to dentistry, because why would you need to have your tooth chart redone at that other dental office?
Right. Yep.
Right. That's one of the things that we actually, as our small mighty technology team is tackling, is interoperability.
Yeah.
Right. And as we do that, we've already tackled security.
Yes.
Right.
Yep.
And so it's kind of like given a window to the future that is kind of our wheelhouse. That's what we do, is we create the future of dentistry at Opera.
Yeah. Yep.
Right?
Yep.
At Operability. There's a reason why it's called Operability. And the reason why it's called Operability is our parent company that creates Opera DDS and Opera VR is because one issue that we are tackling that nobody else, I don't think, really is interoperability.
Gotcha.
Make sense?
Yep.
Never explained that to you before.
No.
I apologize. I thought I did. And now, but there's a problem with interoperability, meaning taking your chart and going all around with it.
Oh, I bet I know this one.
Security. The really one is HIPAA, right? Privacy. There's privacy, there's security, and interoperability.
Yeah.
So when we're talking about interoperability, the big problems with it from a technical standpoint is having the security and the privacy for the patient information.
Yes.
Make sense?
Yeah.
So could you define sort of a situation where you as a patient would want to have your records be transmitted to another office without your knowledge?
Well, if certainly a referral.
Absolutely.
Is going to be a time. And where I don't care. Like, I just need to get the procedure done, right? So it's sending information across to another doctor for dentistry. I don't really care.
Well, that's a big point that you make right there.
Yeah.
And I think that's a big problem that we as providers have, is that we recognize that in most cases, patients don't care.
Right.
But the problem is we have to.
Yeah.
Because in some cases, it's a big deal.
Right.
Right? It's one of those things where it's low risk if the patients care or not, but when they do care, it's a big deal.
Right.
And even if they don't think they care, sometimes they will look back and go, oh my gosh, I care. And the onus is not on you, Dave.
Right.
It's on us.
Right. No, and I absolutely hear you from that perspective. From, when I get involved in sales stuff, a lot of times there's things that people, 99% of the population doesn't care about, but that 1% care deeply. And when you're not satisfying that concern, it becomes a gigantic hassle and an anxiety producing hassle for me, and I'm sure for you as a clinician. If there's if I would say in your practice, in any practice, a lot of people are HIPAA compliant. They do everything they can to comply with HIPAA standards. But there's practices out there where it's like, it's not the biggest deal in the world. Well, it isn't until it is, and then once it is, it's a big deal.
Yeah, and the way you painted it is I think a lot of the ways that many dental professionals think about it. It's like the patient's being a pain in the ass.
Yeah.
Right. If they care, they're being a pain in the ass. First of all, that's flat out wrong. Okay. I mean, people should care. Just because people don't care about their privacy on Facebook, that doesn't mean that's not the same should be true of their health information.
Right.
And the case that I love pointing out to highlight the need for interoperability, secure, and while still keeping privacy and security in place is local grown here and local died Prince, right?
Right.
When Prince died,
the
amazing number of factors that came into play highlight the need for interoperability because he was going across state lines and he passed out, when they had to fly, they had to land, not when he died, but when he
as he was crashing,
right? They had to emergency land, so there's an entourage who was that weren't family members that were making choices for him, and you think his privacy was important.
Right.
We're talking celebrity status where there's different privacy rules and security around the information that was given. There's just it would take a couple hour podcast to unpeel that onion of stuff going on, right? And that's obviously a high profile case when there was a drug overdose, unconscious patient. Physician practicing without a license, across state lines. I mean, the amount of stuff going on was just crazy.
Yeah.
But those are going to be in every practice. Each layer of that onion exists in your practice.
Right.
And the next piece so highlighting the problem first, because I think a lot of dentists don't actually recognize how significant the issue is, the need for interoperability, the need for patient privacy, and the need for security on our information.
Yeah.
Then the next sort of question is, well, what the hell do I do about it, right? And the thing is that there are easy-to-use tools that allow for the privacy and security, not really interoperability yet. That's we hope it's coming.
Yeah.
We're working on that problem, frankly. But like Opera DDS, we do, like you mentioned, referrals, secure, easy, keeps patient privacy at the core, at the forefront. Secure email, digital case collaboration, teledentistry. These tools are inexpensive. They're frankly ridiculously inexpensive. You're probably paying more to use tools that aren't secure and don't provide the privacy, right?
Yeah.
Even if you're using paper, it costs more.
Right.
So I want to just, on this podcast, kind of take a step back and just highlight the actual need for operability, for security and privacy, and then also just state that there's easy solutions. And if you have questions, certainly reach out to us.
Yeah, it seems like those are all holes that our society is going to require dentistry to fill in.
Yeah.
I mean, it's whether it's important to you now, it's going to be important to you later. So it's a must, right?
And what blows my mind is it actually is more efficient. It makes our jobs easier.
Right.
It costs less.
Yep.
We make more money because it's more efficient, right? And you're also checking the boxes.
Right.
So being HIPAA compliant and providing for patient security, information security, right? And being able to work with people online with good patient protection of patients' privacy is actually a easier, better workflow.
Yeah.
So there's no downsides except it may make you may have to change your workflow to do things a better way.
Right.
Which is what we're about. Right?
Yep.
Yeah. And so, but your perspective that you first came up with as a patient, which is like, oh, these people are being a pain who are requiring this, I think that's pervasive kind of in the profession that I hear that from dentists all the time. Like, who really cares? It's a dental chart. Well, it does make a difference because there's going to be people's medical histories, which is impactful. And we've talked before on the podcast about the value of health information on the black market. And so for people, we just can't view it as something that it's the patient's problem. It's the onus is on us to care and to and frankly, it not only to care, but just to pay attention to it and look for solutions that actually make us more efficient and it makes it easier to provide better care and be more productive. So,
that makes sense.
Yeah. So check it out. There's multiple tools out there but multiple within Opera DDS. That's one core issue that we focus on is patient security and privacy and sharing of information in an easy way that makes you more profitable. That's why we call it the easy solution, right, man?
Yeah.
Well, thanks, Dave. Appreciate you being on the podcast.
Thanks, Bryan.
As always. Thanks. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.